This is a patient who is complaining of right upper quadrant pain, and we can see that when we look at the right upper quadrant, there's a lot of inflammatory changes in the fat. When we look at the left, you can see nice, clean looking fat, but when we get to the right upper quadrant, you can see these linear areas of soft tissue or fluid attenuation within the fat, and so this indicates usually inflammation. Now, the inflammation is important to figure out, well, where is this surrounding? And in this particular case, you can see that it's surrounding the area of the gallbladder. When we look at the gallbladder, it's somewhat distended. If we measure it here, it's measuring a little over 4 centimeters, and 4 centimeters is kind of the definition of when something is actually pathologically distended. Now, we can also see that the wall of the gallbladder here looks fairly thickened. If we measure it, for example, here, it's measuring around 8 millimeters. And the other thing to notice as well is that when we look at this area right here, and I'll zoom in for it, we can see that the wall here enhances fairly well around the gallbladder, but this particular portion doesn't enhance. And so this is a patient who has gangrenous cholecystitis. And one of the effects of gangrenous cholecystitis is that you could actually get disruption of the gallbladder wall from ischemia, and then it ruptures, and then you get a perforated acute cholecystitis. And so that's what's going on in this case. The contents of the gallbladder are now spilling out into the peritoneum. And so this is a patient, you can actually see the gallstone here. Those aren't always going to be calcified. In fact, sometimes you're not able to see them on CT, but in this case you can see it. So there's an obstructing stone within the neck of the gallbladder that has led to acute cholecystitis, and then that eventually becomes gangrenous cholecystitis and then eventually perforates. Another thing you can look at as well, and you can't see it that well in this particular patient, maybe subtle, but there's a little bit of hyperemia in the liver surrounding the gallbladder, which you can see from the inflammation from the gallbladder can recruit blood supply into the adjacent liver and give you kind of a rim sign of enhancement within the liver. So that's another sign to look for.